Hey, Minot and the entire nation and globe, if you will. This is Dr. Willy with Your CornerStone and Health here today. Thanks for joining us, even for a minute or two, or listening later. So we appreciate that. It is a fantastic week here in Minot with lots of heat, and so make sure if you're in our area and enjoying this beautiful warm weather that you're hydrating and taking care of yourself. One of the supplements that we sell is called Hydrate. It's a little powder that you add to your water, and I'm encouraging parents to make sure their kids are hydrated up with their baseball games and playing outside at the pool and whatever else it is, making sure they're getting the electrolytes well for this week. So again, lots of heat, lots of hydration is going to be really important this week. So another little quick thing for this Thursday night, and I'll recap this at the end, is that cornhole. We have got a cornhole, small mini little round robin tournament we're doing here at the office, just outside the office on Thursday night. So come join us from 6, maybe for an hour or two there. Myself, my daughter are going to be here. Some of our team members are going to be here. I know Dr. Matt's going to be out playing as well. And so we'll have some snacks. We'll play a little cornhole and hang out. So come and join us and have some fun. Make sure you get in touch with Jay so we can have a list of it. Maybe we're going to make, our goal is to make a little tournament bracket, work our way through that. So that'll be great. So today I want to share with you just a little experience I had last week about visiting the ER myself personally, which I've only done one other time in my life, but this time I'll share about last week. And at the end of the talk here, as I get through some things, I'm going to share something that was a little bit shocking to me that they did not share with me when I was released from the ER. So anyway, at the risk of sharing information about, it's always kind of tiring sometimes when people talk about their conditions or what they got going on, but I think you'll find some of these things interesting. So this last, maybe it was about a week and a half, a week ago, 8 days ago, we were out in Medora, had a great weekend out there and saw the musical, and then on the last day of our trip, I started to have a little bit of back pain in the back, felt like it was a little stiff or sore. And like a true chiropractor, I just knew that there was some extra tension or something from sleeping on a poor bed or something like that. And so I was stretching, doing that, and doing some walking and this type of thing to loosen things up. But then on the way home, got home and unloaded the vehicle, started carrying some things into the house, and the pain was escalating, getting more and more intense, really severe, to the point where I couldn't even stand upright without becoming too nauseous, knowing that I was going to throw up. So I got to the point where I had to get down on the floor and was able to not throw up at that point, which I was very thankful for. But the pain was really intense, and anytime I would straighten up, it would get worse. And so I used some ice that night. I tried to sleep. It was virtually impossible. Got just a little tiny bit of sleep through the night. Maybe a few minutes here and there. Actually wound up trying the couch, trying the chair. Many of you have had severe back pain. You've been through something like that before, but tried the couch, tried the chair. Those didn't work. I had to be flat on the hard, firm floor of our living room. And so had things kind of strewn all over the place. But by the morning, it was not getting any better. This was last Monday morning, and about a week ago. And so anytime I'd be upright, I felt like I needed to vomit and was headed in that direction, so I had to be laying down almost the entire time. So that brought something to my mind in taking care of people with back pain and severe pain for years. Generally vomiting and back pain doesn't coincide. And so it was in my mind that one of the things that does coincide with vomiting is kidney stones. And so that was a concern of mine, and so that's what prompted me to say, hey, we got to go do something about this, because that's not something that you want to deal with. Anybody that's had that, and I haven't before, but I have heard reports that's the guy version of having a baby, is what I've been told. So anyway, I was not looking forward to that. So I went to Trinity, and I laid down in the back of the car. My folks came over, and he drove. My wife was with me, so my dad and my wife were with me. I crawled out to the car, got in the back seat, laid down in the back seat of the car, got to the ER, and they had me sit upright in a chair, which was in a chair as they wheeled me into the ER, and did the intake to get a little information about who is this guy coming in here, not looking so good. And they're getting the information while I'm sitting in the chair. I'm like, this isn't good. And sure enough, was not able to stop myself from throwing up in the ER room. So I'm down on the floor making a spectacle there in the ER. So got admitted. They got me into a spot where they got an IV in my arm, and a huge shout out to really the nurses over there. They did a great job. I remember one of them was named Anna. My provider there, her name was Ginger, and I think she's a PA over there actually, Ginger Strand. So she did a really nice job helping me. But and then there was a couple other nurses and X-ray techs, a couple of X-rays they took. So the biggest thing concern for me was not the severity of pain, because it was bad, but it wasn't like that bad. I've taken care of people in much worse, more intense pain than that. I know that. And so I felt kind of wimpy with that, but the nausea. So they helped me with that right away. And that they got me a little something that took the edge off of that. And then got me a little something for the pain and no narcotics. Told them no, I don't want any of that, which they weren't planning on doing that for me anyway, which was great. And went through all the different tests that you do for kidney stones, which is, a urinalysis, and they took blood work and did a blood test and so forth. So I won't bore you with all the details, except that ruled out any involvement with the kidney. And so this, as a chiropractor, I was shocked by that, because the intensity of this back pain connected with this vomiting. But fast forward, as I got through and ruled out those things, it's very clear to me that the intensity of that pain was creating enough nerve pressure to then cause almost like a referral back to my organs to create a reflex that was a vomiting reflex. And so when our nerves have pressure on them and they supply different organs, there can be a reflex or an overflow of stimulus to something different. And so that's what can happen when we have referral of pain down into the arm, or numbness or tingling. And that pain in one spot that's putting pressure on the nerve can spill over, and it can give that stimulus and create pain or issues in another area. And if it happens to be an organ that's affected, you might have dysfunction of that organ. So anyway, this turns out that it's just severe spasm of the muscles in that area, and a nerve pressure enough to cause that vomiting. And when that edge came off, that was I was able to walk out, actually not being nauseous or anything like that. And immediately when I got home, my first step was to go get adjusted. I knew that was the key. And so if I'd have been able to be upright, actually, I would have come in and gotten adjusted before I went into the ER, because I know that anytime your nervous system is released and you can move better, you can have free nerve flow, you're going to be in a better position to be able to recover faster, no matter what the condition is. And so, but I couldn't even be upright to come get adjusted. So I was able to be vertical. Did not look well, but was able to come in right at lunchtime and get adjusted. Dr. Matt took care of me there in the afternoon. Got my first adjustment there, which really, again, started pushing me in the right direction as well, and my body was starting to recover. So the recovery part of me, quick recovery, couple of days, and was able to, by the next morning I was moving and upright, didn't have any other nausea, didn't have to take any more medication for that, which was fantastic, and was able to enjoy the week. But one of the shocking things to me was that came, and I told you I would share about, was the discharge papers. So I'll share just a little bit about that. So I've got the Trinity discharge papers here, and again, they did a really nice job getting me in a nice facility at the new hospital. I don't recommend you go to the ER if you can help it, of course. Obviously, if it's an emergency, do that, but don't go there just to check it out. But anyway, the people there took very good care of me, and very happy with them. So you get discharge papers. Anybody that's been there, you get them. And so there's a little information about what to do and what will happen if x-rays are taken. A radiologist will call you, which is obviously good. If your condition worsens, call in and this type of thing. And then they had a section on back pain, and so this was particularly interesting to me. So the section on acute and chronic back pain, and what do you do with that? And so the answers in here, they tell you a little bit about what can happen. It can last for 1 to 2 weeks, and most of it recovers in 1 to 2 months. Okay, most people can remain active, which a lot of times they can. And then the different types of pain, everybody's got a different variety, so they explain the different varieties of pain for you there. And then, of course, then they go through a few things that can create pain or create problems, which are pretty clear, and where the pain can be coming from. Of course, it can be coming from a variety of different places, but they go through some home care. And home care, good instructions. When you're in bed, try to find a position of comfort. That's pretty clear. Putting a firm mattress is best. We make those recommendations here in the practice as well. We've got a couple of additional things that we recommend, of course, for mattresses, which we'll probably cover on a different podcast. But they talk about laying flat on your back with a pillow under your knees. Of course, that depends on the person and so forth. But in general, those are good recommendations. Don't sit too long for long periods of time, which I think is actually a recommendation for all of us every day. Don't sit too long for long periods of time. They, of course, sitting is, it's been likened in some circles, it's been said that sitting is the new smoking because of the intensity and the pressure that it puts on your systems and the damage that it can do over long periods of time. So certainly not long periods of sitting, especially if you're in back pain, but anytime. And then, of course, they talk about icing or heating, starting with ice if you just have a new injury, which is very true. We encourage that in our practice, always for back pain. Don't sleep on a heating pad. That's pretty good advice. A lot of times people don't realize this about back pain, but they'll use heat on their back because it feels good, and then they fall asleep. And that generally makes things much, much, much worse. And the reason being is that not so much that you get burnt, which can happen as well, but the big thing is that it draws heat draws blood to the area, which can create some healing and circulation. But if you just stay sedentary or laying down after you've used heat, and you don't get up and move around and flush that blood out of there, that blood pools and it stiffens things up and gets generally much worse when you try and move again in the morning. So don't use heat. I'd never recommend that at any point and fall asleep, or just take a nap in a chair and use heat and you lay there for an hour and a half and you wake up, you can't move. That's the reason. So if you want to use ice and fall asleep, ice on your back, that's fine because your body will get through that, but definitely not heat. They talk about for if you've had medications. I jumped ahead here. So you can alternate, they say you can alternate ice and heat therapy, talking with your doctor, which is good, that's fine. Then they include therapeutic massage can help relax the back muscles without stretching them. And then they talk about beware of safe lifting methods, don't lift anything without stretching. And then they cover some medications, they cover follow-up care, and then if things get really severe, call 911. And when to seek medical advice and this type of thing. So, acute and chronic back pain. Has anybody picked up right now anything that's been shocking that's been left off the list? I mean, I don't know how many of you are listening out there, but, in general, what was shocking to me that was left off this list of discharge paper is the fact that for acute or chronic back pain, you should seek chiropractic care. That's a pretty clear thing. They've got therapeutic massage on here, but there are literally thousands and thousands and thousands of studies that demonstrate the effectiveness of chiropractic care and adjustments of removing nerve interference and restoring joint mobility to the effectiveness of quick recovery from back pain. So it's really interesting to me that still the medical profession is still missing this piece of this connection, that they've got massage on here. Therapeutic massage can help relax the back muscles without stretching them, okay? But they leave out chiropractic care. It's shocking. So to me, one of the probably, I would say without question, the most effective treatment for back pain, and that's can be backed up by many studies that I don't have here in front of me, but very easy to find them. The most effective modality is being left out on the discharge papers. So, of course, the providers over there, that's not something they do. This type of stuff is generated by a system, a machine. It's not the individual nurse. We take care of lots of nurses and PAs and so forth as well in our practice, so it's definitely not the individuals. Because of course they knew I was a chiropractor and they recommended, follow up with your care that that you need, and so they recommended that for me. So again, huge appreciation for them and taking care of myself and my family. But in general, people need to recognize that chiropractic care, should be the number one recommendation, and because of the effectiveness of it. So that was kind of an interesting observation of mine as I was in the ER and leaving the ER, is that they didn't recommend that just for simple back pain. So anyway, appreciate your time, you spending time with us here. I just wanted to recap again. This Thursday we've got cornhole here at the office, outside the office, so hopefully it's not 143 degrees out here on the pavement. And we'll have plenty of water and some snacks for you there. This week, hydrate, take care of yourself. and make sure that your kids are hydrated. Kids go outside, they forget to drink. Young kids don't like to drink water. So get some electrolytes if you need some electrolytes. We've got some here in the office that you can pick up. Powder just mixes right into water. Blue raspberry, orange lemonade, great taste for you. And again, have a great rest of the day. We appreciate you, and all the best to yours in health. And spread the word. Chiropractic is the most effective care for back pain. Even though we don't talk about back pain all the time, it's the most effective care for it. So all the best to you. Be well.